Hello everyone, my name is Juan Ramirez, a fourth-year medical student from the FIU Herbert Wertheim College of Medicine, and today I'm presenting this fascinating case series on two patients who developed hemorrhagic cystitis from the use of docetaxel for their breast cancers, seen here at the Miami Cancer Institute in South Florida. Two patients, one 43-year-old female and another one, a 53-year-old female, were both diagnosed with locally advanced hormone receptor negative HER2 new receptor positive invasive ductal carcinoma of the breast with axillary lymph node involvement. Given the locally advanced nature of these tumors, the standard of care indicated the use of neoadjuvant chemotherapy. The regimen used for both patients included the use of an anti-HER2 directed therapy along with a taxane-based chemotherapeutic agent, which in the case of both patients was docetaxel. After the initial infusion, both patients reported hematuria approximately 2 to 3 days afterwards. Alerted by it, both patients were evaluated in the ED. In the case of patient A, our 43-year-old female, she was admitted into the hospital for a full workup with consults from urology and oncology. You can see here in figure 1, a CT urogram was performed, and as part of her urological workup, there was a finding of a questionable degree of minimal bladder wall thickening, which can be present in patients with both hemorrhagic cystitis and patients who undergo chemotherapy. The patient was managed for her mild hypotension, and once she was hemodynamically stable, she was then discharged home. She experienced hematuria after her second cycle, and from then on, the decision was made to withhold pegfilgrastim for her next infusion, with the reasoning being that pegfilgrastim is known to cause hematuria secondary to acute glomerulonephritis. This intervention is used to help stave off the neutropenia that is seen in the neutropenic side effects of chemotherapy. Despite this, she still reported a third episode of hematuria after her third cycle. After discussing the case in tumor board with other clinicians, it was concluded that docetaxel may have been the offending agent. After review of a past case report implicated docetaxel as causing hemorrhagic cystitis in a patient being treated for a metastatic prostate cancer. Docetaxel was then discontinued and switched to paclitaxel, which has a more favorable side effect profile and improved tolerability. Following this, the patient was able to tolerate the rest of her chemotherapy, and after the completion of 6 cycles of chemo, she was able to achieve a complete pathological response, which is evident in both figures 2 and 3, respectively. In the case of patient B, she was also on the same neoadjuvant chemotherapy and anti-HER2 directed therapy, which included docetaxel. This patient was being treated around the same time as our 43-year-old patient, and after 2 to 3 days from the first infusion, the patient was seen at an ED for complaints of hematuria. And records obtained from this ED visit show that she had stable hemoglobin along with stable normal RBC indices, as well as a normal renal function, with it only indicating an elevated white blood cell count. Urinalysis showed gross hematuria with a minimal increase in white blood cell counts in the urine, as well as a negative leukocyte esterase. This patient was worked up and prescribed nitrofurantoin for a suspected urinary tract infection, and then discharged home. On the follow-up visit with her medical oncologist, docetaxel was suspected as the offending agent, given the recent review of the past case report of it, and she was then switched off to paclitaxel. Afterwards, she did not have any additional episodes of hematuria, and she had an excellent response to the chemotherapy with only a residual 4 millimeter tumor with negative lymph nodes, and this tumor was found to be ER positive and HER2 negative. The patient was able to proceed with further surgical and radiotherapy along with the appropriate anti-hormone directed therapy for this residual tumor. This case report is very unique, as this would be the first documented instances of docetaxel-induced hemorrhagic cystitis in patients being treated for a locally advanced hormone-negative HER2-positive invasive ductal carcinoma. The only reported literature prior to this was the docetaxel-induced hemorrhagic cystitis in a patient being treated for a hormone-refractory metastatic prostate cancer. Workup of both patients included interventions for other possible secondary causes, such as an acute hemorrhage or a urinary tract infection. As hemorrhagic cystitis, depending on the severity of its presentation, can lead to significant morbidity, early recognition and prompt discontinuation of the offending docetaxel are essential. Clinicians should be vigilant for signs of hemorrhagic cystitis in patients receiving docetaxel, and further research is warranted to better understand the mechanisms of underlying drug-induced hemorrhagic cystitis and how to identify strategies or to come up with strategies that may be useful for its prevention and management. Thank you.